Namaskar. I am Dr. Yogalakshmi, hematologist in Kaizen Oncology Network. Today we will see about thalassemia. What is thalassemia? Mainly a common blood disorder, usually not symptomatic. There are two kinds of thalassemia. Thalassemia is basically a hemolytic anemia. Hemolytic anemia means the blood produced in our body will be destroyed in our body itself. In thalassemia, apart from the blood getting destroyed, the production of the blood is also low. So there are two types of thalassemia. One is beta thalassemia, one is alpha thalassemia. Beta thalassemia is the main problem in India. Alpha thalassemia, we have alpha thalassemia cases in India, but it's not a major public health problem. So thalassemia the beta thalassemia also can be symptomatic or it can be asymptomatic. This is basically coming from the parents, so it is a genetic disease. When both parents are having half affected genes, that is what we call as beta thalassemia trait. If they are having half affected disease, that can combine into a child and produce a full-blown disease in a child. That is called as transfusion dependent thalassemia. And even the disease can be either thalassemia major or thalassemia intermedia. Thalassemia major, usually the child whoever got the disease, they become symptomatic at the age of almost around 6 months of age. So what will be the symptoms? At 6 months, the main symptoms of anemia will be there, like irritability, the child becomes pale, progressive whiteness can be noticed in the skin, and the child's paying capacity will be reduced. That is, the child will be irritable always, the child may be crying always. So these will be the main symptoms. Apart from that, because these are hemolytic anemias, the destruction of the red blood cells in our body can produce jaundice, and the child may look jaundiced in the eyes and also in the body. So these are the main complaints. Apart from this, there can be enlargement of the tummy as the day goes by. So these children usually they will not survive without blood transfusion. So the treatment is mainly blood transfusion, which should be given at a regular interval, like once in a month or once in 2 months. Initially the child may require the blood transfusion, and this blood transfusion should be continued almost for a lifelong time. If the patient is not getting any other kind of treatment, the permanent curative treatment, if the child is not undergoing, then the blood transfusion will be required every month. And this also can lead to some complications of blood transfusions, like iron overload, which can affect any organs in the body, and organ failure may result because of the iron overload. Is there any curative option for this thalassemia? Yes, there is a curative option, and that is bone marrow transplant. Bone marrow transplant will replace all the cells which are produced in the child, that is the stem cells which produce the blood of the child, will be replaced by the normal healthy stem cells. So normal healthy blood will be produced, and that will be a curative option for the beta thalassemia who are transfusion dependent. And we have one more thalassemia, beta thalassemia, that is beta thalassemia intermedia. That intermedia usually presents by the age of 6 years, 7 years, like that, or it can present later also. In those kind of patients, usually they are not transfusion dependent. They present with some other symptoms, like they have the enlargement of spleen is so big that they have a protruded abdomen, or there can be some changes in the face, there can be growth failure. So these are all the main symptoms of intermedia, thalassemia intermedia. So transfusion dependent thalassemia is really a big problem, and that has to be treated regularly with blood transfusion, and the complications of iron overload should also be managed, and the only curative option is the bone marrow transplant, which should be done as early as possible for the results to be good. Thank you.